Now moving up to the next page, we have lymphatic drainage associations. Here we can see the lymphatic nodes clusters, that is different lymph nodes, area of body drained, and associated pathology related to it. The very first one is submandibular or submental. Submandibular and submentals drained lymph from that oral cavity, anterior tongues and lower lip, and associated pathology can be seen, that is malignancy and metastasis of the oral cavity. In these conditions, the submandibular or submentals lymph nodes are affected. Likewise, for deep cervical lymph nodes, the drainage is from head, neck, and oropharynx, and associated pathology is upper respiratory tract infections, infectious mononucleosis, Kawasaki disease, malignancy of head, neck, and oropharynx. Now moving up to the next, that is supraclavicular, which drains lymph from, that is right hemiothorax, left Virchow nodes, left hemiothorax, that is abdomen and pelvis. So supraclavicular associated pathology is malignancies of thorax, abdomen, and pelvis. Now the next is mediastinal lymph node, that is drainage is from trachea and esophagus. That is trachea and esophagus, and associated pathology is from pulmonary TB, that is unilateral hilar, and sarcoidosis bilateral hilar, and lung cancer granulomatous disease. Similarly, for hilar lymph nodes, drainage from lungs and have a same associated pathology, that is for mediastinal lymph nodes, that is pulmonary TB, unilateral hilars, sarcoidosis bilateral hilars, lung cancers, that is granulomatous disease. Now the next one is axillary lymph nodes, that is drainage from upper limb, breast, skin above umbilicus, and associated pathology is mastitis and metastasis, especially breast cancer. Now epitrochlear is have drainage from hands and forearms, and affected area it causes that is secondary syphilis. We can say associated pathology is secondary syphilis. Similarly, for celiac lymph nodes, liver, stomach, spleen, pancreas, and upper duodenums. For superior mesenteric lymph node, the drainage is from lower duodenums, jejunums, ileums, colon to splenic flexure. Similarly, for inferior mesenteric, that is colons from splenic flexure to upper rectums. And for all three, that is celiac, superior mesenteric, and inferior mesenteric lymphangitis, inflammatory bowels disease, and celiac disease are associated pathology. Now for periumbilical, that is Sister Mary Joseph's node, periumbilicals, the drainage is from abdomen and pelvis, and associated pathology is gastric cancer. For para-aortic, pairs of testes, ovaries, kidneys, fallopian tubes, fundus of uterus will be the drainage, and associated pathology is, that is metastasis. Now moving to next, we have external iliac that have a drainage from body of uterus, cervix, superior bladder. For internal iliac, cervix, proximal vagina, corpus cavernosum, prostate inferior, bladders, lower rectums to anal canal and anal canal above pectinate line. Similar for superficial inguinal, distal vagina, vulva, scrotums, urethra, anal canals, below pectinate line,